Today we talk about esophageal cancer. Where is esophagus? It is a hollow muscular tube connect throat to the stomach. It is behind your windpipe. Esophageal cancer can start anywhere along the esophagus. It starts when the cells in the linings of the esophagus begin to grow out of control and grows outward through the other layers. Squamous carcinoma seen most in up to third of the esophagus, and less than 30% of all esophageal cancer are squamous carcinoma. The adenocarcinoma seen most in the lower one-third of the esophagus, and more than 70% of all esophageal cancer are adenocarcinoma. In 2021, American Cancer Society estimates about 20,000 new esophageal cancer diagnosed in 2021 and 50,000 deaths from esophageal cancer in 2021, which only makes about 1% of all cancer diagnosed in the United States. But it is more common in some other parts of the world, such as Iran, northern China, India, and South Africa. Esophageal cancer are more commonly in men than women, and white has higher incidence than Asia Pacific Islander. It is more commonly in the elderly than the younger people. What are the 5-year survival rates for esophageal cancer? For the people who has localized disease, 5-year survival rate is 47%. For a regional disease, which means have a local lymph nodes involvement, 5-year survival rate is 25%. And with the disease spread to the other part of the body or distant lymph nodes involvement, 5-year survival rate is only 5%. The overall 5-year survival rate is 20%, which is not high. What are the risk factors of esophageal cancer? Esophageal cancer increases with age. Fewer than 15% of cases are found in people younger than age 55. Obesity increases the risks of the adenocarcinoma of the esophagus, most likely related to the reflux. Alcohol increases the risk of the squamous carcinoma more than the risk of adenocarcinoma. And smoking doubles the chances of getting esophageal cancer. A pack of cigarettes a day or more has at least twice the chance of getting adenocarcinoma of the esophagus than a non-smoker. And the risk does not go away if tobacco use stops. Increased fruit and vegetable will lower the risks of esophageal cancer. However, processed meat increase the risks. Frequent drinking very hot liquid, such as temperature above 149 Fahrenheit, may increase the risk. Gastroesophageal reflux disease can also increase the esophageal cancer. It is the stomach acid escape from the stomach up to the lower part of the esophagus. Many people may not have symptoms at all. Some people may have heartburn or pain. Reflux can also bury the esophagus, which is linked to even higher risks of esophageal cancer. So what is a buried esophagus? This happens when reflux of the stomach acid into the lower esophagus goes on for a long time. It can damage the inner linings of the esophagus, known as a buried esophagus. Most people with buried esophagus have symptoms of heartburn, but some people may not have any symptoms at all. High-grade dysplasia, which is the precancer cells, is linked to the highest risk of the cancer. What do we do to prevent esophageal cancer or lower the chances of esophageal cancer? Avoid tobacco and alcohol is one of the best ways of limiting your risk of esophageal cancer. Watch your diet, increase fruit and vegetable intake, stay at a healthy weight, and being physically active may reduce the risk of esophageal cancer. Modify your lifestyle and diet. If it's not controlled, then treat reflux with H2 blocker, such as Pepcid, and the proton pump inhibitors such as Prilosec, Nexium, and surgery will be the last resort to control reflux. Endoscopy for people who at a high risk for esophageal cancer is another way to lower the chances of esophageal cancer by using the endoscopy to look for the signs that the cells linings of the esophagus have become more abnormal. If dysplasia, which is a precancerous condition, is found, the physician may recommend treatment to keep it from developing into esophageal cancer. In the United States, screening the general public for esophageal cancer is not recommended because no screening test has been shown the effectiveness to lower the risks of dying from esophageal cancer. What are the signs and symptoms of esophageal cancer? Most people has no symptoms. Most of the population may be presented with anemia and black stool. This is because of bleeding into the esophagus. People may have trouble swallowing, weight loss, chest pain, hoarseness, chronic cough. People may have vomit after each meal, first from solid food, maybe later liquid food. How to diagnose esophageal cancer? With barium swallowing test, people will drink a thick chalky liquid called barium to coat the walls of the esophagus. When x-rays are taken, the barium outlines the esophagus. The golden standard is using endoscopy. The doctors pass an endoscopy, which is a thin, flexible tube with a light and a small video camera on the end, down your throat and into the esophagus and the stomach to see any abnormal areas in the walls of the esophagus. Can remove the tissue sampling for test, open the blockage of the esophagus. With ultrasound during the endoscopy, the doctor can measure the size and spread of the tumor and look at the lymph nodes and sample them for possible cancer. After diagnosis with esophageal cancer, you will need to see medical oncology, surgeon, and radiation oncology. And what we can do after the diagnosis of esophageal cancer. Maintain weight is most important. If you cannot eat and keep the food down, feeding tube is necessary at that time. This is a topic of esophageal cancer. Thank you for your time.